Okay, so hello, my name is Dr. Anamika Bheda. I will be moderating today's discussion, which is based on how physical therapy can help women in piles and hemorrhoids. On the panel, I have with me Dr. Priyanka. Could you please go ahead and tell us briefly about your journey in this field?
Okay, hello. I am Dr. Priyanka. I've completed my master's in community physiotherapy from Rajiv Gandhi University, Bangalore. And currently I'm working as a women's cell therapy. I have multiple certifications in women's cell. And I am looking forward to work on a project called She Matters 2, which is like exclusively women's cell clinic, having multiple advanced techniques and physiotherapy treatments for specifically women's health conditions. That's it.
That's amazing. That really sounds interesting. So moving forward, we have Dr. Damini Halankar with us. Can you please give us an insight on your journey into this field?
Yeah, sure. So I have done my master's in Obs Gynec and I have done it from KLE University. So my journey has been very good being a women's health physiotherapist. Like I'm practicing it since a year along with general practice in my own clinic, and apart from that, I'm a freelancer.
That's really interesting. That's good. Okay, so moving on into this discussion, piles is considered to be a national ailment. Be it men or women, heard it in both. Do you think gender difference affects the severity of this condition? Dr. Priyanka, would you like to take this question for us?
Yes, definitely. It's not specifically a gender specific, not because he's a male or female, that's why he's suffering from it, but because woman goes from like many phases, like right from menstruation, right from pregnancy, delivering a baby, and all these incidences definitely matters. They definitely affects the situation and it causes piles. That too.
Right. Yeah, for sure.
And in men, there is a different thing. Like specifically, men go for weight training and everything. If they are following some wrong procedures, wrong techniques for the weightlifting and everything. So there are different causes, and not because he is a male that's why he's suffering, or not because he's a female that's why she's suffering. There are different causes for it.
Right. So multiple researchers have given us all the numbers in the paper, but since you all are with us, we can get that information firsthand from you all. How much do you believe is the prevalence of this disease? And do you believe most of the individuals don't report it at all? Dr. Damini, do you want to take this question for us?
Yeah, see, the prevalence of this disease is much, but as I can say, there are not much researches or literature studies done on this topic, piles. But if you ask me, in my the clinical research or the clinical patients, I can say yes. I have got one or two patients, both male and female. They were complaining about the same, but there are very few PT treatments, like physiotherapy treatments. The articles which I could find, there are very few used as a therapy for those patients.
Right. So,
I would like to add something. I think many people, like many Indian population specifically, I'm saying, they report at like very late stage. Like when they reach to grade 3, grade 4, then they report. Specifically women, I must say that. They report very late.
Okay, so do you think it is because of some belief or certain biases present in our system?
That I don't think there is a bias or something in the system, but it is like that. It is not because of for the piles only for the back pain also. If the patient comes, whenever it is here, then they will report and they'll see a doctor. Okay, the precautionary measures is hardly practiced in India. Whenever it is unbearable, then only they visit and see a physiotherapist or a doctor.
Yes, so that's very true about that. So, pregnancy, delivery, obesity are the most common causes of piles that are heard around. What's your opinion on it, both of y'all? Do you all think there are other most common causes among Indian women, especially, which could lead to piles? Dr. Priyanka, do you want to take forward with this answer?
So, as I mentioned before, that there are many causes for the piles. The pregnancy, obesity, and these things are very common, like very common. But there are other certain things also, like diet specifically, the dietary habits, then gym. I mentioned that wrong techniques while weightlifting and everything, breath holding and everything. Then while pregnancy also, we had like hardly in India it is very practice that ANC and PNC proper care during labor also. So there are many certain things that can attribute to this condition.
Okay, and Dr. Damini, do you want to talk about a few causes that you think are prevalent in India?
See, I could say the main cause is pregnancy, definitely, because still in India, women are unaware of their own health. You know, the right position to take care of, the right position to take care of during each and every activity. Secondly, I would say some trainers who train in the gym, they need to have proper knowledge about it, because you know what, they just know how to train a person. While I will say that they must be not knowing properly about the anatomy or physiology, and the one who is actually taking training from those are unaware. So definitely they will land up in such position. So one of the fault I can say is there, like they should be properly trained so that they can train somewhere else.
Yeah, that's a really good point. That gives us a good insight about the causes. So there are different grades of piles. What grades of piles do you all think can be treated with physical therapy? And what muscles do we mainly need to concentrate and strengthen?
See, there are 4 grades. So grade 1 and grade 2 can be treated. Okay, grade 3 needs to be, manually taken care of again by this, and grade 4 requires surgical thing. So the main muscles are to be trained, like the pelvic floor muscles, mostly the external and internal anal sphincters. There are certain exercise, like when I went through an article, there is a new therapy, like there's an invention of new therapy, that is a cold compressor therapy. I couldn't open that article because of some issues, but they have used a cold compressor and they have asked to squeeze the pelvic floor muscles in that. So if I will be able to open that article, I will definitely share with you people. And then there are this rectal muscle strengthening, and then contract and relax and all those exercises. Basically Kegels exercises.
Yeah, elevator exercises where we can control our movements, our anal movements, opening and closing. That is all that works well with piles.
With piles. Okay. Do you think any other muscles need to be strengthened or concentrated on along with just the pelvic floor muscles?
Core muscles are definitely important to work on, because pelvic floor, of course, is a part of core muscles only. But when it comes to core muscle, usually we think that it's only abdominal and back muscles. But no, it is right from diaphragm, pelvic floor, abdomen, and back muscle. It is like a cylindrical thing we need to work on. It's not only pelvic, but we need to work on entire core to get the proper control. Yes.
Yeah. So
and secondly, I would like to add one thing. Secondly, that we always tend to teach our patients pelvic floor contraction exercise. So along with that, we also need to teach the relaxation exercises to them. So this is like the pelvic floor exercise comes in combination with contraction of muscles and relaxation of muscles. So relaxation can be given by breathing exercise, It can be given by yoga, and then we can combine it with strengthening exercise.
That was an amazing addition to the question. And pain and piles are very commonly connected with each other. Like whoever has piles, the first complaint we hear is pain. Like probably that's like the first symptom of piles where that they realize. What are the different PT approaches that we can use for pain?
See, for pain around the groin region, we can use IFT. We can use TENS. Then we can use sitz bath, warm sitz bath, where the temperature is maintained like between 40 to 42 degrees, and we can take it for 5 to 10 minutes. And as I said, there's a new invention of cold compressor. If I could open that article, I will maybe discuss with you.
Even vaginal steaming works well with piles, like for the hip relaxation. Vaginal steaming is a basic thing a person can practice at home as well. So that works well.
Okay, so y'all definitely go with the idea that pain can be treated at home and people can do those basic things, get relieved of pain, and don't need to keep coming for every session to the clinic itself, right? They can work with it at home.
Yeah, partially they can manage their life.
Yeah, so exercise is the main thing. They have to come to the clinic so they get proper guidance with it, right?
Not for the exercises only. There are other things also which are like a manual therapy for it. There are some massages for it. Then there is many other modalities, like some different vaginal stimulations are there, different vaginal stents are there. There are different, many advanced technologies has come up with it. So for that thing, then patient need to come, but partially they can manage them at.
Dr. Damini, what's your opinion on it?
I agree with Dr. Priyanka. Some patients can, partially manage themselves by doing all the exercises, and that too exercises which are perfect, and not just by randomly searching somewhere on Google or taking some advice, because it can anyways worsen their condition as well. So they can according to their therapist what they suggest, they can continue.
Okay, so this was some good piece of information since people are really virtual at this time due to COVID. So this was a really good piece of information for them. Moving forward, do you think breathing exercises can help assist pain in piles? Dr. Priyanka?
Yes, definitely. Breathing exercises, as I told you, we need to take care of the core, which includes diaphragm as well. And breathing exercises definitely work with your diaphragm. And along with that, as I told you, about the proper technique for the strength training, proper technique for the defecating, all this weightlifting or defecating. So these things, along with the breathing techniques, will definitely help patient to cope up with their pain. Definitely.
Perfect. Dr. Damini?
Yeah, it is like, breathing exercise definitely helps, and teaching them right position for breathing exercise helps more for them. So yeah, definitely breathing exercises help them. If you sync your breathing exercise with pelvic floor contraction and relaxation, it helps them more to achieve the relaxation as well as to learn how to contract the pelvic floor muscles. Along with that, it also helps for the activation of abdominal muscles and training of intra-abdominal pressure.
And even breathing techniques, we do teach pregnant ladies for them to help them during their labor as well, which can help them to prevent a certain amount of this condition. Breathing exercise during labor is must, I must say.
Exactly.
Okay.
And secondly, along with teaching them breathing exercise, this is always correct their posture as well, because most of the people, if you have to their posture assessment. They are further around it. Suspect not to efficiently perform breathing exercise. So if we correct the posture along with that, it will give a wonderful results.
So it's like very basic breathing and posture correction things can really help with the pain of piles, and that's very nice piece of information to know. The second major problem that people deal with piles is difficulty passing stools. Do you all think PT can help with that problem? Dr. Damini?
Yeah, and along with that, when we suggest them sit part, it also helps to relax the muscle. Along with that, increase the blood circulation. So relaxation of muscles makes them easy to pass stools.
And even certain positions also, like positions with like 30 degree of hip elevation and leaning forward, that help the patient emptying their bowels easily with less pain, I think.
Dr. Priyanka, do you think there are some maneuvers or exercises that need to be done as a routine which can help improve the defecating part?
Yes, as I told you, the positioning plays a very important part for it. And secondly, the maneuver to prevent, some exercises to prevent piles are different. Some exercises when the person is suffering from the piles are different. Which is, there are very basic exercises which anybody can perform.
Can you share one or two exercises with us which can help prevent piles in those early stages?
Yes, definitely the very important and the very common exercise, that is Kegels exercises. It's like when we ask patient that imagine you're urinating and you have to stop in between. So what movement we do? Many times we ask patient, like whenever patient comes to a clinic, we ask patient to palpate their parts and see what the movement is exactly. And then you have to take your part in. If possible, you can hold it for 1 or 2 seconds and then you relax it easily. Just take it in and relax it easily. These are the Kegel exercises, which is very commonly practiced and very helpful.
Dr. Damini, do you want to add something to it? Some exercises that can help prevent piles.
Actually, I couldn't find much of the articles, but there are some yoga positions which I would like to show.
Mm-hmm.
Balasana is.
Yeah, see, this is one of the yoga position where it is combined with breathing exercise, helps in piles. This is a slight difficult exercise. Yeah, so those who can perform this will definitely. Then this is happy baby pose. So, these are some positions of yoga which also helps them to relieve pain.
Okay. And a large number of women who are suffering from piles also deal with fecal incontinence. Do you all think so? Fecal incontinence is also a major part of women suffering from piles?
Yes, definitely. There are many cases of fecal incontinence with piles. It's very commonly seen. It obviously later grades, not with the initial grades.
And can physical therapy help deal with fecal incontinence? Like, we know there are exercises and there are maneuvers to help deal with urinary incontinence, and people are very much aware about urinary incontinence. Fecal incontinence is not that openly spoken about.
Yeah, there are few researches about it, but with our practice, which we usually practice at our clinic, yes, definitely we can do it. I've seen many cases. I've seen good results with the electric therapies also, and along with this exercises.
Specifically IFT.
Specifically IFT, yes. IFT works amazingly with people in any kind of incontinence, I must say.
RFT has given very good results.
Results,
It,
yes.
in
There is no
increasing
as such research. We need to look forward to do some research on it and publish it as soon as possible, Dr. Damini. What do you think?
Yeah, exactly, definitely. See, I would like to show a diagram picture. So this I could find the 4 grades of like internal hemorrhoids. So as I said, grade 1 and grade 2 can be treated. Grade 3, this part needs conservative management, and then grade 4 needs surgical management. So usually what happens is it is difficult to pass stools in grade 3 and grade 4 for most of the people. Grade 1 and grade 2 is still manageable. So even if they try to increase their intra-abdominal pressure and try to pass their stools, so the piles will definitely increase and it will lead to more dangerous situations for them. So what they have suggested in this article is you can apply a small ointment which acts as a lubricant near the anal sphincter, so it helps. It becomes easy for them to pass their stools. And secondly, what they have asked, there is a exercise where they have to contract their anal muscle as if they are stopping the flow of the gas. So this is how they contract their anal sphincters. So that's what there's a exercise which I could find in one of the articles. So it was specifically for anal sphincter, where you have to contract your anal muscles as if you're attempting to stop the flow of gas from the anal sphincter. So this has been proved beneficial for many of the patients. Like what I tried for 1 or 2 patients of mine, to some extent it was, but then I will say that grade 3 and grade 4 are not, that treatable with PT.
And do you all think sacral nerve stimulation is something that can help our patients?
Yes, definitely it works, because as we discussed, the fecal incontinence is a very common complication of the piles, which is more related with this sacral nerves. If we stimulate this nerve, then we can definitely help the patient with the control part, we can pain part, weight strengthening part. Yes, definitely it helps.
Dr. Damini, do you have something to add to that?
No, actually, I don't have much to add with, because as I said, it is only the clinical practice. You don't have much of a research or much of an article on this thing.
So that was an amazing answer for sacral nerve stimulation. And we definitely now know that we need much more research on this topic, since we are lacking research.
Yes, definitely.
So, do you think there are any PT-related treatment options that should be explored a little more, that you think might help, but they have never been explored, so they're not being used? Dr. Priyanka?
But as I told you, vaginal steaming, actually we used to practice it for postnatal cases. But then I just tried this thing. This is like a harmless treatment, I must say. We tried with the bile patients, and yes, definitely patient gave us a nice feedback which they can practice at home as well. Vaginal steaming is, like, I must say, need to explore more, and we need more research on it. Not for the curation part, but just to manage patients symptomatically. So we can explore more treatments on them. With a lot of pain, we have like limitations, what to do and what not to do. If we are relaxing the patient, if we are making patient comfortable, then we can definitely do much of the manual therapy and maneuvers with it.
That was an amazing conservative management approach. And definitely we do need more research about it. Dr. Damini, do you want to tell us some treatment approach that you think needs to be more explored?
See, I think the Kegel exercise only needs to be explored because there are, some patients who are not still aware how to perform Kegel exercise. In front of us, it is very easy for them to, ऐसे हाँ में हाँ मिलाना कि yes, सब आ गया है, I know each and everything. After going home, they just stop doing everything. They just forget what is Kegel exercise. They forget how to contract and relax. So teaching them first properly, making them aware about their condition, making them aware about the muscles which has to be contracted and relaxed, and then making them aware about the importance of sits part. I think if we make them aware about this condition, it will work like a very good thing. Like it will be a very good results for them. And there are many more. I can say if we have, if we happen to have a research on this, we could come up with a new treatment plans.
For sure, yeah. I feel Kegels is a very underrated exercise. Not everyone is much aware about that exercise. It's just heard when you go to a PT clinic and it's forgotten when gone home. So the one technique that Dr. Priyanka explained us earlier, that how you're urinating and you try to stop the urination, and that's one way of teaching Kegels. Do you all think there are other different ways or techniques which can help to teach Kegels exercises?
Yes, I can explain one more easy technique, that is we put a roll of a towel on a chair and we ask patient to sit on it. Then we ask, you need to touch the towel and then you need to elevate your pelvic floor. You need to touch it and then you need to elevate your pelvic floor. That is easily understood by the oldies specifically.
Yeah, the oldies have major problem in understanding this.
Understanding, yeah. But this technique they can easily understand. Then I need to touch it, I need to take it up. I need to touch it, I need to take it up.
Yes, that seems a very interesting technique, which is heard for the first time. That's going to be a good piece of information for our audience. So all our fellow physical therapists, they can use this technique moving forward. Lastly, what are your tips for young men and women? How can they avoid suffering from piles as a whole, like not getting it in the first place? And what are some day-to-day lifestyle changes that should be done or which can help to prevent piles?
First of all, dietary changes, regular exercises, lifestyle changes specifically, proper technique for defecating, proper techniques for lifting weight. Are like they are very small things we say, but these all contributes a lot for the etiology of the piles. I must say that during pregnancy you need proper antenatal care, you need proper labor health, you need proper postnatal care. Many people nowadays, they come for antenatal at least, but then during labor and postnatal they just forget themselves and they just be busy with their kids and everything, just forget to take care of themselves. And that may lead to, like, maximum cases are with women only, we say. The prevalence is more with women specifically. That is because of this delivery, specifically normal delivery. So they forget to take care of themselves. They just, they dedicate their life to their child postnatally. But I would definitely suggest all the ladies that do take care of yourself properly, even when you are with your kid. You can, these are the many exercises, many, or you can definitely do at home with your kid. You don't need to come to the clinic all the way that because of the kid, it is very difficult to reach out to the physiotherapist all the time, but you can always reach out to us virtually, on call. We can anytime help you with that. Obviously, the efficacy is not that as same as when you are visiting, but yes, at something is better than nothing, I would say.
That was an amazing ending message for our women out there. They definitely just give up on themselves for the family and for their kids, and it's just forgotten, and it comes into attention when it reaches a stage where it can't be conservatively managed. So, yes.
So true.
Dr. Damini, do you want to add something to this?
Yeah, I would add few things like as Dr. Priyanka said, definitely diet and exercise helps a lot. And today's generation needs to be, counseled about it. Diet can include, high fiber diet, and they can avoid drinking alcohol. They can avoid have coffee. It definitely affects it. Then yeah, exercise. I've got a piece of writing here that long sitting leads to engorged hemorrhoidal plexus and swelling. Long sitting, so we should suggest them to avoid long sitting, and they can help them. So long sitting position, it leads to engorged hemorrhoidal plexus, and it also increases the swelling. So we should suggest them to avoid long sitting, and to have other sitting positions, or to have little stretching if they are in long sitting position, so that there's not continuous pressure created. Secondly, hygiene is very necessary. They should be, educated about the hygiene. And then defecation counseling. Most of the people now, have started using Western toilet, English style toilet. So because of that, the anal sphincter, the anorectal angle is reduced, and it is, very difficult for them to defecate. So it might be the cause to increase the piles. So either, they can place a stool near their foot, or they can use a Indian style washroom. This is about the defecation counseling, so that their sphincter muscles are completely relaxed, and it is easy for them to pass through.
True.
And the other treatment is sitz bath, as I told earlier. I would add one more thing. Relaxation, they can also achieve relaxation by dry heat. You can just warm a towel and you can apply over the sacral region, and you can slightly massage the sacral region. It is also a very, good technique of relaxation. It is also a very good technique of relaxation for them. It also helps to relax the muscle as well as easy in passing stools.
Those sound like really amazing conservative management techniques. Like, people don't have to get out of their comfort. They have to be at home. They find all these things at home, just minor changes, and they achieve the help they need to prevent piles in the first place. That has been an amazing interview. The information that we got, be it vaginal steaming or the use of IFT or changes in the defecating postures, all of these things have really thrown light on many minute details that we usually do wrong in day-to-day life. And just correcting them is going to help the woman as a whole. It's going to improve their sustainability, their lifestyle. It's been amazing talking to you all. Thank you so much for this information, for taking time and helping us with this. Do you all have anything else to end?
Nothing. I would just like to say that physiotherapy can help women in like every stage of her life, in every problem she has. So there is less awareness, first of all, about the physiotherapy, and second of all, about the women's health physiotherapy. There are specialists for women's health therapists, and we can definitely help you all in all the problems you have. We can definitely do that. So do reach out.
Yes, that's the message that actually needs to get out there, so people can come back and get help.
And for all the students, sorry to interrupt, but for all the students and all the physiotherapists, we really need to research a lot and need to publish our researches. There are many colleges have made a compulsion to do a research, but not all the researches are being published. So we need to do it seriously. We need to really take it seriously.
Yeah, there are itself many untouched topics, I can say, in women's health, which they are not considered, they are not done and research on. So I would like to suggest upcoming students who would be taking this course to definitely work on this untouched topic, to do some research and help for the betterment of future.
We can do that.
Yes, definitely.
Definitely,
Would
we
love
can
to
do
see your
that.
work.
It's a suggestion for the students. We can
Yeah.
definitely do that.
Yes, please. If once you'll do that, please share your work with us so that we can put
Yes,
it out
yes, yes.
there and spread more word
Definitely.
about it. It's going to be helpful to millions of people, be it Indian women or outside
I
India.
have already 2 researches published in international journals. I will definitely share it with you.
Yes,
That's
that
great.
would be really amazing if we can get the links to those.
Yes, definitely. I'll share it.
Okay, so thank you so much for your time and efforts and being a part of this. PhysioZest is really obliged to have you all on board for this interview. Thank you so much and have an amazing day.